So we'll make a start. So thank you all for coming and taking time out of your evening and diaries. Tonight we are going to be talking about gastric ulcers with Claudia Gilders. The evening will run through the different types of ulcers, diagnosis, prevention and treatment. And the presentation will be split between squamous and glandular ulcers. So there'll be an opportunity for Q&A after each section. Feel free to write your questions in the Q&A box and I'll put them to Claudia as and when we get time. So a little bit about our panelist, Claudia. She has a certificate, and I always have to read this bit because it always catches me out, but in advanced veterinary practice with a focus on internal medicine and has a keen interest in gastric ulcers. She's been part of several research studies focusing on them, and she's actually been with us at Cliff Equine for 4 years now, having graduated from Nottingham University and doing her internship at the Royal College of Veterinary Surgeons, the RVC. So that's a little bit about her. Enough of me, and we'll pass over to Claudia.
Hello, everyone. I'm just going to share my screen. Ooh, you're going to have to let me share my screen, Rihanna. Apparently, I'm not allowed. We just need to do that thing we did this morning.
Oh, no.
1 second, everyone. As soon as I can share my screen.
Oh, it's not as simple as it was this morning. Hold on. Here we go.
Did you have a backup plan? She does have the presentation too, in case.
I think you should now be able to share your screen.
Perfect. Yeah, I can. Okay.
Super.
Okay. Can you see the presentation now? Are you seeing that, Rihanna?
Yes.
Okay, cool. Okay, so this is just going to be a bit of a presentation on equine gastric ulcer syndrome. So yeah, the horse's stomach is relatively small compared to their size. So a horse's stomach in a standard horse can only actually contain 10 to 15 litres of fluid. So for a horse's size compared to some other species, that's very small. The horse's stomach's actually designed to tolerate small trickle grazing meals. So horses are designed to be out at pasture eating for 16 to 18 hours a day. They're not designed like we are, for example, to eat larger portions and then go for long periods without eating in between. The next slide does have a little bit of a post-mortem, so if you're squeamish, maybe just look away for a second. But this is a horse's digestive tract. So as you can see here on the bottom right, we start with the esophagus, so that's where the food will go down the horse's food pipe and into the stomach. So you can see relative to the rest of the digestive system, this is quite small. When we go from the stomach, we go into the small intestine and into the cecum and large intestine. This is very large in the horse because a horse is called a hindgut fermenter. So a large majority of their digestion actually happens in the large intestine rather than the small intestine and the stomach. Then we move from there into the colon and the rectum. So the horse's stomach is actually separated into 2 different parts, depending on the lining of it. This is quite unique to horses. Human stomachs, for example, don't have this. So the top part of the horse's stomach is called the squamous portion. And this is this light pink color here. And the bottom part is called the glandular part. And the line that separates the 2 of them here is called the margo plicatus. So if we were to enter through your esophagus, you can see here on the right, this is where we'd come into the top part of your stomach, and then we go all the way around and food comes out through your pylorus and goes into your small intestine. So equine gastric ulcer syndrome is actually the broad term for all forms of gastric ulceration. But the actual more accurate way to describe the disease is very dependent on where those ulcers are. So we actually like to separate them into 2 separate disease processes because the squamous portion, so the top portion of your stomach, and the bottom portion of your stomach, the glandular portion, are actually 2 separate organs within the stomach. So we separate them into equine squamous gastric disease, and they're the ulcers that would occur on the top portion of your stomach, and equine glandular gastric disease. And those are the ulcers that would occur on the bottom part of your stomach. So the clinical signs that are have been associated with gastric ulcers are very vast. They're very non-specific. And so what that means is that horses with a variety of different conditions will actually show these signs too. So it's not recommended that we would diagnose a horse with ulcers based on their clinical signs alone. But horses may show some of these, which would include girthiness, so resenting having the girth done up. What we call cutaneous hypersensitivity, so that's resentment of being touched in certain areas, so they might resent being groomed over their flanks or their stomach area, or having their rugs put on. Poor performance, which can vary greatly, so things such as bucking when under the saddle, not wanting to jump, unwilling to maintain a canter, variety really, there's so many. Aggression, particularly around food or feeding times, can be seen. A nervous disposition or very anxious horses can be a sign associated with gastric ulcers. Acute and recurrent colic is slightly less common, but definitely can occur. Usually these horses might colic after they've eaten, or it might be a low-grade grumbling colic. They may have a very poor appetite or be picky around their feed. They might have weight loss, a poor coat condition, so they look very scurfy, and they also might grind their teeth quite a lot, which can be a sign of discomfort. So the only way to definitively diagnose both the squamous and the glandular disease is via a gastroscope. There have been various studies that have looked into other diagnostic methods, usually looking at things to do with the feces, but none of these have actually been accurate. So it's still the only way of actually diagnosing them is via putting a camera in and actually visualizing them. What we have to use is a 3-meter flexible fiber optic camera that's passed down the horse's nose and into the stomach. So when we go up the horse's nose, we are then looking at the back of the horse's throat. So if we were to go down this hole here, that's into your horse's windpipe. And then this area here is your epiglottis and your larynx. So these are structures that help your horse swallow and breathe and vocalize. What we need to aim for is this top right-hand corner here, and that's where your esophagus sits. The image we see on the screen is actually a mirror image of what's actually happening. So your esophagus actually lies slightly to the left-hand side of your horse's throat. So we will aim here and we'll get your horse to swallow the camera. Once the horse has swallowed the camera, we're then just passing down through your horse's esophagus. This is a very soft-walled structure, so you can see it's kind of collapsing around the camera. So we usually have to inflate it with air slightly so we can pass it down. In a standard size horse, this can be up to 2 meters long, which is why we need such a long camera to get down into the stomach. Once we're in the stomach, we might see a picture like this. So this is looking right at the very top of your stomach. So this is an area of that top portion, the squamous portion of your stomach. And then we will look around with the camera, all the different areas of the stomach. So when we look down, we will start to see the change from the squamous portion here, this top portion, to the darker glandular portion, which is down below. And this is that area called the margo plicatus, which is the separation between the two areas. What we'll do with the camera is we will follow that the whole way around the stomach, checking all of the areas of the stomach for any areas of ulcers. When we get round all the way around, so we can see this is where we've come in. So we've looked all the way around and we're now looking on ourselves. Here is called the lesser curvature of the stomach. So that's the smaller curve of the stomach. And that's also a very common place for ulcers to occur. We then pass the scope underneath this little bridge and we will come out at the bottom of the stomach, which is called the pylorus. So what we're looking at here is actually the exit of the stomach. If we were to go through that little hole there at the bottom, we would actually be in the horse's small intestine. So they're the main areas that we look for ulcers. These are the most common areas that we see them. So if you were to bring your horse in for a gastroscope, things you should expect. So we normally ask you to arrive the day before. We will give you a consent form to fill in, maybe a questionnaire asking about clinical signs that you've been seeing or things that you're concerned about, and we'll normally weigh your horse when they come in. So food is then removed 16 hours before your scope, so they can't have food overnight. And that is because we need to make sure that the horse's stomach's fully empty in order to be able to see everything accurately. And in order to do that, we do need 16 hours of no food. So they need to be in a stable with no bedding, because horses will unfortunately eat whatever they're on, and then that obstructs the scope. They may need a muzzle on. Some of our repeat offenders will eat their own feces as well, but usually most of them are absolutely fine in a rubber matted stable. We usually take the water out 1 or 2 hours before the scope. They don't need to have their water out the whole night. It's just to stop them having a huge gulp of water before we take the scope, and then we kind of have to swim through it. It just makes our life a little bit harder. We have to usually give them a little bit of sedation. They usually don't like us passing their scope up their nose unsedated, and we'll probably pop them in stocks so they're nice and still. We will then review the images, either with you if you're in the hospital with us, or we'll call you up afterwards and we can send the images to you. And then based on the lesions or ulcers that we see, we'll come up with some discharge instructions and treatment that you might need. It's not always the case that we have to have it done at the hospital. We can come out to the yard to you as long as we have electricity and you have somewhere that's appropriate to starve your horse. So if we just focus on the top ulcers to start with, we'll go through a little bit about the squamous gastric disease. So yeah, these are lesions that occur on the top part of the horse's stomach, and they're usually associated from anything that allows the stomach acid to touch the sensitive portions of the stomach. So that top area of the stomach should not have acid touching it. It starts to erode away at the cells and cause these ulcerative lesions. They can occur secondarily to delayed gastric emptying, because if the stomach has a large amount of food in it, for example, with a gastric impaction, then the stomach acid sits higher than it should do and it's able to reach those areas. That's slightly less common. So prevalence in horses, 80 to 100% of racehorses in training will have squamous lesions within 3 months of training. So it's incredibly common to see in racehorses. Around 60% of sports horses and pleasure horses will also have these lesions. 60 to 90% of endurance horses will have them at the time of competitions. So again, it's very, very common. Horses that are rarely competed and kind of kept out in an almost natural living in a field scenario have about a 10% prevalence of this disease. So it's not as common if horses are out all the time. So when we do our scopes, we will grade the lesions of the ulcers that we see. It's not the case necessarily that the higher the grade, the more severe the clinical signs are. So it does need to be looked at based on your horse's history and their clinical signs they've seen. Some horses can be just as painful with a grade 2 ulcer as they can with a grade 4. Things that affect thoroughbreds that might typically be less stoic than a cob. You know, they might not need as severe ulcers. So again, it's kind of for our knowledge, but it's not necessarily to say that just because they're a lower number means it's not as important. So we grade them from numbers 0 to 4. A grade 0 is when the epithelium, so the lining of the stomach's intact. So that's what a normal area of the squamous portion of the stomach looks like. So that would be considered completely normal, grade 0. So if it's a grade 1, it's all intact. There's no actual ulcer there, but there's an area of hyperkeratosis. And what that means is that it's starting to look thicker and more yellow. So this is not technically an ulcer, but it might show that the stomach's getting a little bit unhappy. So grade 2 is when there's a small single or multifocal, so lots of little lesions on that area of the stomach. So this, for example, might be considered a grade 2 because we can see that there are some areas of ulceration there, but they're not that severe at all. A grade 3 is when we have a large lesion or quite a large area where there's some superficial, so not very deep lesions. So this, for example, might be considered a grade 3 because it's a large area here, and there's some smaller areas where it's quite a bit deeper. Grade 4, so the most severe of the ulcers, would be extensive lesions and quite deep ulceration. So this, for example, might be what a grade 4 lesion looks like. You can see it covers almost the entirety of that area of the stomach, and it's kind of actively bleeding. So we know that they're quite deep. So risk factors for getting the squamous lesions, there's a variety of lesions, but they all seem to have the same problem in that they allow that top portion of the stomach to be exposed to acid, either for long periods of time or regularly. So horses with an absence of turnout or absence of contact with other horses can have an increased risk of getting squamous disease. No access to free water, no free access to water is not very common in today's management systems, but it's something to be aware of. Reduced fiber in the diet is probably one of the most important ones. In the horse's stomach, the fiber will sit down at the bottom area of the stomach and provide like a natural buffer to stop that acid hitting areas where it shouldn't. So we need to provide hay and other forages that will kind of provide that buffer. Chewing also is very, very important. Horses will have to chew hay a lot more than their concentrate meals. So hay is a very important part of it. The more your horses chew, the more they produce bicarbonate in their saliva, and that's a natural buffer to the acidity in the stomach acid. So what we actually want them to do is just chew as much as possible. Leaving a horse for more than 6 hours between their meals has been shown to increase your risk of squamous disease because their stomach's getting too empty. Again, a high cereal concentration, so feeding them high amounts of starch, such as barley and other grains, can produce the acidity in increase your acidity in your stomach from bacterial fermentation. And high levels of exercise, because as your horse is moving, acid will splash up at those areas of the stomach that are very sensitive to it. So the treatment of squamous disease, the licensed treatment is oral omeprazole. And what omeprazole is a proton pump inhibitor. And so what that means is that when it's absorbed from the stomach, it goes into the bloodstream, and that will affect the cells that are in the horse's stomach, and it will stop them being able to produce as much acid and helps reduce the acidity in there. The omeprazole itself is altered by stomach acid, so it's often formulated in a paste that helps degrade the stomach. It helps stop it being degraded by the stomach. There's lots of different formulations. I wouldn't be able to say that one is better than the other. As long as they have been approved, then they are all relevant treatments. They should be given for approximately 3 to 4 weeks, once daily on an empty stomach. And it is important that it is given on an empty stomach. So we usually recommend that it's given first thing in the morning, when they've probably finished their hay net for a good kind of 4 to 6 hours before we give it. And then we need to wait an hour before we give them their main meals. If it is not possible to give this treatment, or horses have been shown they haven't responded to the licensed treatment, there are other formulations of the omeprazole which could be possible to be given. We do have to prescribe via something called the cascade, so we should always try the licensed treatment first, unless we know it's not going to be possible. For example, if a horse lives out, we know that we're not going to be able to give it on an empty stomach, therefore it wouldn't work very well. So there are other formulations, such as injections of omeprazole, that need to be given once weekly, and that means that we don't have to starve them. So this is an example of some squamous lesions. This is the same horse 4 weeks later. So you can see here he had quite extensive ulceration on this lesser curvature of the stomach, and 4 weeks later this is all completely healed. So this is what we're aiming to see 4 weeks after we scope. Squamous ulcers usually are the easier ones to treat, and it would be on the rarer side that we don't see them have quite a good resolution, because they are so related to acid. Reducing the acid always helps them heal. So this is what we're aiming to see in 4 weeks' time. Prevention strategies for squamous ulcers. We need to increase the time spent chewing long fibre. So things we can do if your horse eats their hay net very quickly overnight, while we think we're giving them a lot of fibre, if they eat it in 2 hours, they're then spending a very large portion of the night not eating at all and starving themselves. So things like double netting your hay net, providing lots of smaller hay nets throughout the day, forage balls, anything that can slow them down, tying it in the middle of the barn so that they have to kind of fling it around a little bit. Everything that slows them down and makes it last longer can help increase that amount of time that the fibre stays in their stomach. Providing constant access to fresh water and increasing turnout or access to forage. So just making sure that they always have something they can be grazing on. I would also recommend that we feed a scoop of chaff or something along those lines a good 30 to 60 minutes before riding. And what that does again is just provide a good fibre mat on top of that acid to stop it splashing as much when we're riding them around. And then if we have treated our squamous disease, I usually recommend that we consider a good gastric supplement going forward to try and help prevent gastric ulcers reoccurring. So there's an awful lot of supplements out there. I wouldn't be able to say that any one brand is better than the other, but we do know there are certain substances we like to see in our gastric supplements. I usually ask for owners to see that there's a good antacid in there. So that might be something like magnesium hydroxide or bicarbonate, and that will help neutralize the stomach acid. And then other substances we like to see, I'm going to butcher this completely, but there's a yeast called Saccharomyces cerevisiae and a substance called pectin-lectin. And both of those seem to potentially increase the mucus down at the bottom of the stomach and help provide a bit of a barrier against ulcers forming. We do our own gastric supplement, but there are many out there. So these are the things I would recommend we look for. In studies, they've shown that they don't seem to make ulcers any worse compared to a control group that wasn't on them. So by extrapolating that information, we'd like to hope that they might help prevent ulcers occurring. So that's a little bit about squamous disease. So we can move on to some questions. And then we'll go on to glandular disease.
Okay, so can you hear me, Claudia? Just thumbs up if you can.
Yeah.
Great, cool. So a couple of questions that have come through here. So just going back to the reasons for those ulcers. So absence of contact with other horses. Is that because this causes stress in being separate, or does it include individual turnout or literally being kept with no other horses?
I think it would be hard to say the exact cause, but I think it's probably to do with stress. If horses are stressed or in the kind of fight or flight response, they're not thinking about putting their head down and eating as much. So I would imagine, individual turnout, as long as they can see others and they're happy in their environment, should be absolutely fine.
Okay, cool. And moving on to the next one. So going back to your point about feeding 30 to 60 minutes before riding, one of our attendees gives a hay net. So she's eating while she's grooming and tacking up, but that's probably only 15 minutes worth of eating. Is that substantial enough, or what do you mean by feeding before riding?
So I think, for example, if a horse could eat a quarter of a hay net, something like that, that would be sufficient as well. Some horses, for exact dietary reasons, we would not want to give a whole scoop of chaff. So I would say a good quarter of the hay net, ideally about half an hour before you ride, just so it has a time to reach the stomach and kind of settle down there before you ride, should be absolutely fine.
Okay, brilliant. If a horse has constant hay and grazing, would feeding chaff before exercise still be applicable? Rosie has assumed that the hay would have the same effect, or does chaff act differently, perhaps due to a shorter length?
I would say, yeah, as similarly as before, hay probably does have a similar effect. I suppose it's just harder to know exactly how much your horse has eaten if they've been out in the pasture grazing. So that would be why, you know, a scoop of chaff, at least we know that they've had a solid amount. But if you know your horse has eaten a lot of hay in the field before you bring them in, that's probably going to work just as well.
Okay, super. And this is an interesting one. So if a horse is showing behavioural issues due to ulcers, would that be consistent behavioural issues, or could it vary daily depending on how the horse was feeling, I suppose?
I think it probably can vary. It kind of depends on how much pain your horse is feeling. It probably depends on how acidic their stomach content is at any time. So, for example, if they have gone periods of time without eating, that might make them a lot more sore. If you're riding them and you land a jump, sometimes we find that they might buck because, for example, the acid has splashed up and hit an area. But that's things, unfortunately, that we'll never truly know because horses can't tell us. But I would say it's not something that I would say, unless just because they're not being girthy every single day doesn't mean they don't have ulcers.
Brilliant. Okay, and just a couple more here. So I'm assuming this is probably, yeah, I'm sure you're probably going to touch on this, Claudia, with prevention, but once the ulcers have cleared up, how quickly can they return again?
Again, that would probably be incredibly hard to say. We'd like to think that with the appropriate preventatives in place, they won't return, but we can't say that for certain. I don't think there are any studies out there that show exactly how quick they would return in a normal population. We can induce ulcers very quickly experimentally by doing all the wrong things. So starving them for large periods of time, feeding them a lot of grain and barley. But with the right management in place, I would say there are a large majority of our horses that we treat, that particularly for squamous disease, that we don't see again.
Brilliant. And one for a specific horse here. So my horse cribs and has ulcers. Would you say that there is a link between cribbing and ulcers? Does the cribbing cause the ulcers to get worse, or is it just a symptom of having ulcers?
That's actually a really good question. It's probably a little bit of a chicken and an egg type situation. Crib biting, obviously the horse is sucking in a lot of air. If they're doing that, they are having quite a large empty stomach and therefore allowing stomach acid to hit those sensitive areas more easily. However, we do also know that when horses crib bite, that can be a sign of stress and pain. So they may have started crib biting because of their ulcers. It would be very hard to say exactly which one started first, but again, it can be both. It can be a symptom and a cause.
Super. I think that's everything for now.
Okay, so we will move on to the glandular gastric disease. So these are the ulcers that occur at the bottom portion of the stomach. They're less well understood, and that's probably because they're caused by quite a variety of different factors. The exact inciting causes are not well known in the horse. Stomach acid should actually normally sit down here. That's where the stomach acid would normally be. So while there is probably a component of the acid causing these ulcers, it's probably actually likely to occur from a breakdown in the normal defense mechanisms, allowing acid to reach areas that it normally wouldn't. So about 50 to 60% of racehorses have been found to have gastric disease, and it's very prevalent in the sports and leisure horses. So 50% of leisure horses and 60% of sports horses will have gastric glandular disease. Thoroughbreds and standardbred horses, so the warm bloods, are much more likely to have ulcers than the cold-blooded horses. So the areas of disease in the glandular region are actually described as lesions rather than ulcers. And the grading of glandular lesions has been shown to be very poorly correlated with their severity, being that when we have a lesion in there, there's probably a lot more diffuse inflammation that we can't see. So for that, because they can appear in such a variety of different shapes and sizes, we recommend that we describe them rather than giving them a grade. There's nothing to say that one that looks a certain way is actually a lot more or less painful than others. So we describe them on a certain criteria. So we describe them based on their severity. So we'd say they're either mild, moderate, or severe. We then describe them based on their appearance. So I'll go through some examples in a minute, but a hyperemic appearance is that kind of pinkness to it. Hemorrhagic, obviously, if they look red and bleeding, and fibrinous, appurative, they have this kind of thick yellow pus-like discharge to them. We then describe them based on how they're sitting in the stomach, so depressed, flat, or raised. So these are all some examples of equine glandular disease. Therefore, you can see how they can change and how many different presentations they can have. So this top lesion here is something that we'd call a nodular lesion. So you can see here it's very raised. This is quite a severe one. It's quite a large lesion here. Around here, and so the top right, these are kind of flat hemorrhagic lesions. They're kind of striated all around this area of the pylorus. And this one on the bottom left would be a slightly more mild, but again, we can't say any more or less clinically significant than any of the others. But this would be a more mild, and this is these areas of hyperemia, so these slightly pink areas and looking a little bit sore. And then the bottom right here, these are what we describe as our fibrinous appurative lesions. So you can see they look quite yellow and pus-like, and these are actually eating away underneath. So I would call these some depressed lesions here. So you can just see there's such a wide variety of lesions down here. Some of these respond to different things. That's why we think these are quite multifactorial, but again, we just don't understand all the different inciting causes yet. So risk factors for glandular disease, warm bloods we do know make up quite a large proportion of the horses we see. We're not really necessarily sure if this is a genetic component to it or whether warm bloods make up a large majority of our competition, etc. horses, and that might be why we're seeing an increased prevalence in these breeds. We do know exercise for more than 5 days a week is an increased risk factor. Inexperience, so younger horses, particularly in polo and show jumping, in certain studies have shown that they're at increase of getting these glandular ulcers. It may be related to stress. With inexperience, we're not necessarily sure. Stress, we do know, is a very important risk factor in glandular disease. So things like horses that are competing, if there's a change in their management, so changes in field mates, anything that might cause them some stress. Changes in environment, so moving yards or traveling around, all of these things can increase your risk of getting glandular disease. Non-steroidals have been spoken about a lot as an inciting cause of causing glandular ulcers. It's actually been shown that at standard doses, both butanolone, those kind of non-steroidal drugs, do not seem to cause gastric ulcers when we're giving them at normal low doses. They can induce gastric ulcers when we are overdosing on them. So at normal levels, I would like to think that they don't have much of a risk factor for causing glandular disease. The treatment for gastric glandular disease is less well understood, so therefore it's kind of difficult and challenging to treat. We don't necessarily have a licensed option for the glandular disease like we do with the squamous disease, because oral omeprazole alone has been shown to be very poorly effective in treating those glandular disease. About 25% of glandular diseases will fix on oral omeprazole alone, so that's very low, so it's not usually recommended as a sole treatment. There's no one treatment that fits all for these glandular lesions. We may have to try one, and depending on how well it works, we may need to move on to something else. But because of this, we can usually tailor the treatment based on your horse's presentation and the management system that you run. So we do have slightly more options here. It's usually a combination of some form of acid suppression, because we do know that acid, even if it might not be the inciting cause, will reduce healing in that area, and then some form of substance that provides a protective barrier. So it potentially could be oral or injectable omeprazole. And injectable omeprazole has been shown to be a lot more effective in treating glandular ulcers than oral omeprazole, but we may add something called sucralfate. And that's a particular type of salt that has been shown to provide a very good barrier in the stomach and also help produce more mucus. So we usually add that in. Or there's a different drug altogether called misoprostol. Misoprostol works in a slightly different way. There is definitely some acid suppression to its effect, but it also helps regulate blood flow to the area of the stomach. So either or, these are both very relevant and effective treatments. So, for example, this is a horse that's responded very well. So this horse had these very nasty fibrinous suppurative lesions. We put this horse on injectable omeprazole and sucralfate, and this was its scope 4 weeks later. There might be a little remnant of an ulcer just here, so we might want to continue for a little bit longer, but I was very impressed with this horse's response to its treatment. Typically, the length of treatment for glandular lesions takes quite a bit longer than squamous disease. We like the horse to be seen every 4 weeks for a rescope. And that's really important because we do need to see how they're progressing. We don't want to waste time and waste money on treatments that we know aren't working. Therefore, if it's not, we're going to need to change on to something else. Glandular disease can take 8 to 12 weeks to resolve, so we do need to be aware that resolution might not be as quick with those top ulcers. So depending on the outcome of your scope may depend on what we want to do next. If the lesions have all resolved, that's wonderful. There's no need for any further treatment, and we would just continue with management changes. If the lesions are better but not resolved, then we know it is working, but we know these take quite a long time. So we would continue on the same treatment for a little bit longer and rescope again after 4 weeks' time. If the lesions showed no change or they had actually deteriorated, we would want to switch you on to a different treatment option that we hadn't tried before to see if they're more responsive to that. If ulcers are really not going at all and we've tried a good 12 weeks of treatment, we might actually look at biopsying those lesions. A few of them have been shown to be more like irritable inflammatory bowel disease and therefore might need steroid treatment. And very, very rarely they may have a bacterial component to them, so they may need antibiotics, but that's an incredibly rare treatment choice. So preventing gastric glandular disease, we know that horses that are at increased turnout have a reduced risk of getting it. So being out as much as possible would be very important. Reducing stresses is very much easier said than done, but trying to keep their management system similar, trying to keep them within the same herd so they know the horses they're with, or for example, moving them away from a horse that's regularly beating them up, that will increase stress in their life. We like to give them at least 1 to 2 days off exercise a week, maintaining routine and management conditions, and also considering adding some corn oil to the diet, because corn oil has been thought to provide quite a good buffer and protective layer at that bottom part of the stomach. So usually, unless they're on a strict diet, that would not be something I'd be recommending for a horse that needs to lose weight, because there's a lot of calories in oil. But for example, your high performance horses where that's less of an issue, I'd like to add some corn oil into their diet. So yeah, that's a little bit about glandular disease. Do we have any questions about glandular disease?
We do, bear with me, Claude. So, good question here, I think, about prevention. So if a horse is out at grass 24/7, should we still be giving hay?
I think it very much depends how much you have out in your pasture. If you have enough grass out there, that should be absolutely fine. Grass will have a similar effect as the hay will, but if you're on a relatively, particularly in the winter, for example, there'll be less grass around, so we might need to add a little bit more forage to help them.
Okay, super. This one we get a lot actually. So can ulcers be resolved with good management, or do they always need to be treated medically first?
I think ulcers probably don't heal with management alone. I think once we have caused an ulceration and actually an erosion and a break in the normal lining, we probably have to add pharmaceutical treatment in order to reduce the acidity enough to allow it to heal. Potentially less so with the squamous ulcers, but the glandular lesions in particular, I think need medical treatment. So unfortunately, good management is always something to put in place afterwards, but I usually recommend treatment first and then providing good management afterwards.
Okay, and in relation to the oils you mentioned, would other oils such as linseed oil be helpful, or is it just corn oil?
Yeah, it's not something that is has been exclusively diagnosed, scientifically tested. So I imagine the linseed and the corn oil and the maize oils will all have a relatively similar effect.
Okay, brilliant. Again, we've touched on this. So if a horse has ulcers but they do not get diagnosed, will they ever heal by themselves or just get worse? You've touched on that, unlikely to go away unless medically treated. Let me just keep scrolling. Would it be a good idea to give a gut balancer, even a horse hasn't been officially diagnosed with ulcers?
I think gut balancers are always a good idea to consider if it's something that helps your horse. A lot of the gut balancers will have a lot of the supplements that we have described, which are good for gastric ulcers. So a lot of them will have an antacid in, maybe some pectin lectin. A lot of them have good pre and probiotics, which is good for all gut health. So the stomach as well as the intestine. I think if it works for your horse, it's always a good idea to add them in.
Great. This is an interesting one. In spring grass, obviously, we all know that the sugars can be high. Can that upset the stomach pH? And could spring grass also be a contributor to gastric ulcers?
I would say grass potentially wouldn't be increasing your stomach acidity as much as concentrates would. So while it might have slightly more sugar in, I'm not sure exactly whether it's been looked at scientifically as to how much it can increase the acidity in your stomach. The main concern would be from your concentrates, because it's actually the bacteria, a bacterial fermentation that produces things like lactic acid and volatile fatty acids, and they are the things that really decrease your stomach acid. So potentially it would make your stomach acid a little bit more acidic, but I'm not sure if it would be enough. Grass is still required to be chewed a lot and has quite a good fiber max, so I'd like to think that it still does a better job than the concentrates would.
And another question from a lady called Sarah. So if a horse is unridden and all stress factors have been removed, would you, and the ulcers are still not healing, would you be looking at that point for another cause of pain? So potentially something causing those ulcers, for example, kissing spines?
Yes, I think so. So particularly with the glandular lesions, sometimes when we have lesions that occur very quickly back again, or we just can't treat, we regularly look for sources of pain because we know that is a source of stress to horses. So things like kissing spines can be quite a common thing we find when we're looking at gastric ulcers. Now, whether they've caused the gastric ulcers or not, it would be impossible to say, particularly because things like kissing spines can present very similarly to gastric ulcers. So they might present with bucking under the saddle or decreased willingness to go forward or jump. So which one is causing the signs and which one is relevant? They may both be, one may be causing the other, etc. So it would be worth getting both treated. But yes, a full orthopedic exam and a back workup is usually where we'd look for horses where ulcers just will not heal.
And another question, just going back to the corn oil suggestion, is there a special type of corn oil, or is it the same type you buy in a supermarket? And in terms of levels, how much are we meant to be feeding?
So corn oil you can buy in the supermarket. It would be the same corn oil that we would be eating. Usually we recommend about 45 mils. So that was about a cup. Is what I usually recommend putting in the feeds. Again, it's going to be what your horse is able to tolerate due to the calorie amounts. Some horses really don't like the taste of oil in their feed when it gets too oily. So it might be a case of introducing it slowly.
And what percentage of horses that you have scoped have had ulcers?
We reckon, we did have a discussion about this. We reckon about 60% of the horses that we scope have ulcers, which is pretty much reflective in the general population. So as you can see, we might see quite a lot of pleasure horses and sports horses, and about 60% of the population in both of those will have some form of ulcers, either squamous or glandular. I think we do see that in the population of horses that we scope. Usually when we do a gastroscope clinic, we might have a higher percentage of horses with gastric ulcers, but these are horses that are showing typical signs, so the owners are already concerned. So normally, we don't have very many that don't have ulcers, but these are higher risk horses. They're showing clinical signs.
And you have touched on this a little bit, but a lady called Rosie's asked, at what point should a horse be scoped for ulcers? Obviously, such a relatively high percentage of horses have them, so it sounds like it's a procedure that could almost be done routinely. And otherwise, is it only when a horse is showing symptoms? And what other possibilities are ruled out? So at what point is it time to scope your horse, I suppose, is the question.
I think it would probably be worthwhile scoping your horse if you are concerned, so if they are showing clinical signs, mainly because if the horse is showing no clinical signs whatsoever, if we scope them and they don't have ulcers, sometimes your insurance company might not cover them for ulcers in the future, but also we might not know if they're relevant. So some horses can have ulcers and show no clinical signs. Some horses can have clinical signs of very mild ulcers, but if they're not showing any signs whatsoever, it's quite difficult to say whether or not they're going to get better with treatment. If you are concerned about your horse or you want to know, then absolutely we can scope your horse, but typically we would usually recommend a scope when there is a clinical sign.
Another question, so interesting one I've not heard before. Can horses get ulcers from boredom? Do you think that can be a triggering factor?
I think it can be, yes, because boredom and stress kind of go hand in hand. Horses that are not stimulated might show what we call stereotypical behaviors. So they are higher risks of things like wind sucking, box walking, weaving. All of these things are not conducive to them sitting down eating their hay for large periods of time. So I do think boredom could be a sign of stress.
Okay. And can colic be a trigger for ulcers? Another chicken and egg question, I suppose.
Yeah, I think you're right. It could either be because of the ulcers, but also in the nature of colic, we usually have to starve horses for some period of time to clear the whatever the cause of the colic is. If we're doing that, then obviously we are increasing our risk of getting ulcers. If horses have to be hospitalized to get rid of their colic for any reason, that might be a sign of a cause of stress. So all of these things put together, they are higher risk of getting gastric ulceration.
Super. And how much would you say that it costs to treat ulcers?
It's not cheap, unfortunately, which is why we would usually recommend you check that you are covered by your insurance company for ulcers. If you've never claimed before, then hopefully you are. For squamous lesions, it's probably a little bit cheaper. Usually just because it's not going to take as long. We'd probably say somewhere in the ballpark of maybe £500 to £700 for a month's worth of treatment. If you're having oral omeprazole, it can be more expensive if you're using injectable omeprazole. For glandular regions, for a month's worth of treatment, I would probably say in the region of £800 to probably £1,200 for a month's worth of treatment, and that might be required for multiple months to heal. So it can cost quite a lot of money to treat ulcers.
Okay, and a lady here, her friend has had a scope and had a nosebleed during that scope. Is that a common side effect of the gastroscope procedure?
It can occur. It's not something that we would be particularly concerned about. But we are having to pass the scope up the nose. The nose is a very sensitive area, and horses can have nosebleeds. It can look quite dramatic in a horse because they're so big. We have to remember that if we were to take a blood donation from a horse, we could easily take 9 litres of blood. So in losing a little bit of blood from their nose from a nosebleed, it's really a drop in the ocean. So they're normally sedated. It can occur, but it is not the most common of things.
And a lady just going back to the point about insurance, so just a concern. So, for example, if someone signed up to our gastric ulcer clinic, if they paid for a scope but no ulcers were found, would that still have to be declared to the insurance company?
You wouldn't necessarily have to declare what you've done there and then if you're paying for it, but insurance companies regularly ask for your history when you do make a claim for anything, and therefore it will be on your history that you've had a scope, but it will be on there that you didn't have ulcers. I can't say that every insurance company will not strike ulcers off. It's completely up to your insurance company, but yeah, you can't really hide anything on your clinical history from your insurance company. Whenever you do make a claim later down the line or renew your policy, they will be able to see your clinical history.
I will just say on that point that if there were no ulcers found and it becomes a problem in the future, we can write appeal letters or help you to, in that instance, to say that that would be an unfair exclusion. Again, not saying that we'd be able to get that overturned, but there are definitely things that we can do from this end if it was a genuine investigative procedure and no ulcers were found. But yeah. So I think, let me just double check. One moment.
Brianna, there you go.
Oh, super. Just double checking that we've got, yes, I think that's all the questions. So thank you very much, Claudia. That was very informative. I thought I knew a lot about ulcers, but I think I've just learned even more, which is amazing. As some of you may know, we do have a gastric ulcer clinic coming up in April. So as you can see on the screen, the dates are the 5th and the 7th of April. I will just say actually that the 5th is already fully booked. So we've got, we've extended another 2 days the week after, which I believe to be the 12th and the 14th. So for anyone interested or wanting more information and getting booked onto that, do have a look at our website or give us a call in the office. And finally, if anyone requires a CPD certificate for following tonight's webinar, please feel free to email our inquiries email address and we'll be able to sort that out for you. But thank you, Claudia. Thank you all very much for coming and enjoy the rest of your evening.
Thank you very much, everyone.